So the procedure we normally perform as an outpatient, meaning you'll go home the same day. It's primarily done under general anesthesia, which means you'll be asleep the whole time. Usually it takes about an hour to do this procedure. Sometimes it can take longer if we add other procedures into the foot or ankle, which might be required for wound care. So typically the procedure is done into the ankle, where I'd make a small incision into the skin and a small cut into the shin bone. That's the cut that's the most important in order to help heal the ulceration later on. By doing so, we stabilize the cut in the bone with 4 pins. It almost looks like a little Spider-Man across the top of the foot. This is an external device called an external fixator. This device stays outside of the leg and helps stabilize the cut that we made in the bone. After the procedure, the patient is able to walk 100%. There's no additional weight-bearing modifications as a result of the procedure. We are very thorough and informed with our patients. We make sure they have all the information they need afterwards as to how to take care of the pin sites and what to do with it. So usually during the procedure, after about 2 weeks or so, we have the patient come back into the office and make sure everything's okay. There is a little dial actually on the external fixator that the patient is required to turn at home to both elevate and depress the osteotomy site that we create. This is how we fool the body into creating more blood flow down into the foot and the ankle, and to help release something called growth factors into the foot and ankle to super boost the healing of the ulcerations in the foot and ankle. We will follow the patient pretty consistently after the surgery on a weekly or bi-weekly basis to make sure the diabetic ulcerations are healing well, the external fixator device is doing good, and that the patient has no concerns. Typically after the surgery, we will have them come back and around 7 weeks back to the hospital to remove the external fixator device.